Good afternoon, Michelle Alvarado. My topic, active surveillance, low risk cancer. Next, definition. The excellent prognosis associated with most low risk cancer, combined with the potential for avoiding treatment side effects, make active surveillance may a promising alternative to more intensive approaches. Active surveillance entails close follow-up of patients diagnosed with low-risk cancer. The objective is to avoid unnecessary treatment of men with underlying cancer and you only those who show signs of disease progression so as to avoid treatment related effects that may reduce quality of life. Definitive treatment is offered at a time when disease progression is detected and cure is deemed possible. Video.
That's because one of the real options for men with lower grade prostate cancer, lower risk prostate cancer, is to do what we call active surveillance, where we decide we're not going to treat the cancer early on or immediately. We're going to monitor you closely, and at some point, if the cancer tells us that it's behaving more aggressively than we might think, then we might decide to treat you. And the reason being for this is that we know that prostate cancer, even when it's more aggressive, in many cases is still very slowly growing. So we feel we have enough of a head start on it in those cases to watch it initially and then determine if ever you need treatment. Thankfully, what we found is that many men that go on active surveillance don't eventually need treatment at all. So if you go into it knowing that you're at a very low risk of progression, it may be a choice that you make to decide to do active surveillance. There really are no strict guidelines for active surveillance. In general, I think most of us believe that a repeat biopsy sometime in the first year is helpful. We've started to use MRI technology, which has really developed in the past few years and allow us to see cancer within the prostate to make sure there's no more significant cancer that for whatever reason was missed in the initial biopsy. So we often are using MRI as well, and even being able to pair the MRI with newer techniques in how to do the biopsy to get a really precise biopsy of those areas. We generally recommend getting a PSA at least a couple times a year, and those repeat biopsies every 1 to 2 years after the first year.
Next, application in nursing, talking vital signs, weight gain apatient signs, give health education, psychosocial support, participation in the talking of laboratory tests, medication administration for pain. Pros and cons. Advantage. Does active surveillance achieve equivalent of better outcome in terms of length and quality of life that definitive treatment. Disadvantage. But achieving widespread adoption will require further work, further refinement of the surveillance approach. is a going incorporation MRI, target biopsies and molecular biomarker. Issue apply in Ecuador. Does not apply in Ecuador. A systematic review of prognostic factors that may identify men most susceptible for active surveillance was undertaken by UK National Collaborating Center for Cancer during the development of the 2014 Clinical Guideline for Prostate Cancer published by the National Institute for Health and Care Excellence (NICE). Included four analyses from three studies, all of which report results with endpoint of cessation of active surveillance, but did not report overall survival rate, prostate cancer specific mortality rate, or quality of life outcome. Factor analysis include PSA velocity, PSA doubling time, PSA level at diagnosis, PSA density, free PSA to total PSA percent. Video.
Hi, I'm Dr. Joe Pettis. It's well known in the medical community that low risk and even some intermediate risk prostate cancers are overtreated. It's also well established that some patients may have regret about their treatment choices for prostate cancer because of the mental and physical impact of treatment side effects on their overall quality of life. The average prostate cancer diagnosed because of the rising PSA will take 8 years to become symptomatic and take another 5 years to actually cause death. That means that if you did nothing, on average, you'd live about 13 years. Active surveillance is not the same thing as doing nothing about your cancer. It's simply postponing treatment and treatment side effects until the cancer demonstrates that it's gotten worse. Patients who are most well suited for active surveillance are those with low or very low prostate cancer and those with life expectancies of less than 10 years. Young, healthy patients are often steered towards early intervention, but they can certainly do active surveillance as long as they are committed to the close follow-up and periodic prostate biopsies. There's no widely established active surveillance protocol, but the typical schedule would be to rebiopsy at 3 months after the initial diagnosis to confirm low-risk status, and then to do quarterly or semi-annual prostate exams and PSA levels. A confirmation biopsy is necessary to make sure that the first biopsy did not simply catch the tip of the iceberg due to sampling error. The prostate is generally biopsied every 1 to 2 years, or if the rectal exam changes or PSA changes dramatically. In older, less healthy patients, the biopsy frequency can be reduced to every 2 years, but they should still get semi-annual prostate exams. The triggers for moving ahead with definitive treatment with radiation or surgery are if your Gleason score increases, if your prostate exam becomes more concerning, or if the volume of disease significantly increases on biopsy, or if you become too anxious to continue active surveillance. I'm often asked, doesn't this strategy make it possible for the cancer to get worse and spread? The answer is yes, but it's very uncommon in very low and low-risk prostate cancers. Some patients will never require treatment at all and will never be burdened with the side effects that come with surgery or radiation. Active surveillance is not for everyone. There's a small amount of risk involved in waiting. However, there are a variety of genetic tests currently on the market and others soon to be available that can help to estimate the risk for life-threatening disease and ease your mind about the safety of delaying treatment. Active surveillance is a treatment strategy that capitalizes on the slow growth of prostate cancers. Many patients can put off any life-changing side effects from surgery or radiation. In many cases, patients may be able to avoid treatment altogether.
Conclusion. In my opinion, so that active surveillance is another option apart from pharmacological treatment must be thoroughly investigated with their respective experiments that reach the required objective. Bibliography. Thank you.